everybody, and welcome to Jeff the Pharmacist. It is an honor to have you here, and thank you for tuning in. So today I want to talk about SSRIs. So SSRIs are the most commonly used drugs for depression. I made a video about Zoloft, and that kind of just made me think, why not just talk about the whole category of drugs. In general, in school, as pharmacists, and I think physicians probably too, think about drugs in terms of like categories, broad categories, and sort of what they generally, what their general side effects are. So I'll just talk about SSRIs generally. I might make another video about specific drugs in the future, but for now I just want to talk about SSRIs as a general category. So SSRIs are not the only type of antidepressants out there. Really, the old antidepressants are called monoamine oxidase inhibitors, and those have tons of drug interactions and some that will kill people. So they're not that common. If they are used, the doctor, the pharmacist, and the whole clinical team, they have to be very careful about drug interactions. You know, psychiatric drugs in general have a lot of interactions, but monoamine oxidase inhibitors are probably the most dangerous, besides maybe some other antipsychotics. But monoamine oxidase inhibitors are very dangerous. They're kind of the oldest class of antidepressants. There are other classes that are still pretty common, tricyclic antidepressants. SNRIs are fairly commonly used, and there's a whole kind of broad other category that they have their own kind of way that they act. So SSRI means serotonin selective reuptake inhibitor, which means its antidepressant action is related to its activity on serotonin. So basically what it does is it increases serotonin levels in the brain by reducing its reuptake in the neurons. So I don't know why it works. Like, I don't think anybody knows exactly why it works. The brain is so complicated, but it has to do with serotonin. I said before that I think to call depression a chemical imbalance is a little bit tongue-in-cheek, and that I don't think SSRIs correct a chemical imbalance. I think depression is much more complicated than that. It has to do with a lot of environmental things, and it has to do with genetic factors. Just to call it an imbalance, I think, is unfair. I do think there's like genetically people are more likely to have psychiatric illness if it's in the family, or more people are more likely to have psychiatric illnesses if they've had a lot of trauma in their lives, especially in their childhood. That can contribute to depression, and it's a whole like myriad of factors. And I don't really know exactly why SSRIs work. They are proven to work. The thing with antidepressants, though, is that across the board, there's none that really stick out as far as being the most effective. SSRIs are fairly popular because they're very safe, and their side effects are pretty reasonable. We would say they're pretty well tolerated. The differences between the different antidepressants are more related to side effects, and some drugs are used for their side effects. Like trazodone is, I always see trazodone used because it's used for insomnia, but it's really an antidepressant with kind of a sedating side effect, and it'll actually be used for insomnia. Mirtazapine will be used because it helps with appetite and also helps patients fall asleep. So but there's not really an antidepressant that sticks out as far as effectiveness. Now, SSRIs, probably the most common annoying side effect for people is sexual dysfunction. Maybe for some people even more than annoying. I mean, it can be very, very bad, and a lot of antidepressants cause libido decrease or erectile dysfunction for men. And they also cause decreased libido in women, and it's very common for that to occur. I made a video about it. but it is very common. And one thing to keep in mind with SSRIs is that they take a little while to become effective, but the side effects are pretty quickly emerge. Some of them get better, like nausea, vomiting, or if it causes a headache, that usually gets better over time. Obviously not for everybody, but for most people it gets better. Unfortunately, the sexual side effects aren't like something that goes away, and it can be a real problem for people. There is one other like antidepressant that kind of sticks out. It's pretty popular, is Wellbutrin or bupropion, which isn't as commonly associated with sexual side effects. Some people can gain weight on SSRIs, more with Paxil or paroxetine. And another common side effect is akathisia, and this is a feeling of restlessness or like a need to move around, and can even kind of manifest as a restless leg syndrome. So if someone starts an SSRI and then they develop restless leg syndrome, a lot of times those two things will be connected to each other. Increased fall risk in elderly people, probably related to the akathisia, or the feeling that they need to move around more. There's an increase in bleeding disorders or bleeding risk with people that take anticoagulants or blood thinners. So that's an issue that can occur with SSRIs. And I talked a little bit before about monoamine oxidase inhibitors. Those have a lethal interaction with SSRIs. So monoamine oxidase inhibitors are always brought up because they're super dangerous. They're not very common, but they interact with everything. So it's something to be aware of. There's also an antidepressant discontinuation syndrome. So I made a video about it. It's kind of weird, the effects that people can get. The easiest antidepressant to get off of, if that's a primary concern, is Prozac or fluoxetine. And that's because it has a very long half-life, so when you stop taking it, the drug stays in your body for a while and allows you to, it's kind of a natural taper, you know, it's like your body kind of tapers it down by metabolizing it, and it has less of a SSRI withdrawal. So in general, SSRIs are very well tolerated, but probably the worst thing for the worst, most common side effect is probably the sexual dysfunction. There is a black box warning, an increased risk of suicide in young patients, and I don't really know why that occurs. I've heard different theories, like sometimes when people take antidepressants, they might start to be more. The symptoms of depression might get better. They might look more cleaned up, more put together. They might take care of themselves a little bit, but they might still have depression. So they might be a little bit more motivated. So maybe that's why there's that increased risk of suicide. I'm not really sure why it occurs, but it is out there. One thing I want to talk about is I think antidepressants are like a scapegoat for a lot of things. I really do not think that they cause all these societal ills like mass shootings or different things like that. I mean, I think that's more of a correlation. Most people that are mass shooters have had visits with psychiatrists before. They have depression, a lot of them. They have obviously a lot of psychiatric issues. So most of those people are going to be prescribed antidepressants or different psychiatric drugs. So to blame the psychiatric drugs, I think, is not quite correct. Maybe. I've seen in the interwebs that try to blame akathisia as the reason that people commit mass shootings, like people are restless, and I don't really see the connection. I think mass shootings are more like an American societal phenomenon. So I don't know exactly why it occurs. I don't know if it's because of you know, Hollywood, video games, a general lack of face-to-face like communication, or people hanging out together, or maybe there's too much digital communication. I don't really know exactly why. I don't think SSRIs are quite the culprit. I think if you're on an antidepressant, I think you should definitely exercise. I think exercise has a great natural benefit. There have been studies that show that exercise helps with symptoms of depression. You know, obviously controlling your weight is helpful, and you know, I can personally attest, you know, being heavy can be depressing. Just general lifestyle things obviously help, but I think that there's a place for antidepressants. So if you hate antidepressants, leave a comment. If you have any questions about the video, please leave a comment. If you want to hear about any specific antidepressants, let me know. Probably make a video about it. So I want to thank you guys for watching. If you made it this far, please subscribe. It would really help me out a lot. I want to thank you guys for watching. Thanks a lot.